In this video, we'll be discussing percutaneous discectomy. In medicine, percutaneous refers to any procedure that's performed by a needle through the skin. For a percutaneous discectomy, a thicker, larger diameter needle and small tools are used to remove the herniated disc. Most patients only have a small incision from the needle following the surgery. Usually the patient is sedated but not completely asleep. Using X-rays as a guide, the surgeon will pierce the skin with a skinny needle and carefully place it into the disc. Because the patient is awake, feedback will help prevent irritation of the nerve while placing the needle. In other words, pain will guide the surgeon away from the nerves. The skinny needle is used as a cannula to guide a thicker diameter needle into the disc. It's like placing a small straw over the skinny needle. After the straw is confirmed to be in the disc, instruments then can be passed through to remove the disc material that's thought to be the cause of pain. Nuanced differences in the techniques can utilize traditional graspers, suction devices, camera-assisted visualization, lasers, and other high-tech or modern-sounding instruments. In the end, the result is the same: the removal of the herniated disc material. Unfortunately, it's not as simple as it sounds. The outcome of percutaneous discectomy is not as predictable as most surgeons would like. The reasons are many. Percutaneous discectomy is often considered because the disc herniation is not as large and the physical exam findings are not as definitive. Percutaneous discectomy is thought to be a less invasive and therefore less risky option. Because of that reason, many who would not normally choose open incision surgery will pursue this option. Surgeons know that people with a large disc herniation and the perfectly matched physical exam findings of corresponding numbness, reflex changes, and weakness will have the best predictable outcome. In this ideal scenario, formal open incision microdiscectomy is the operation of choice with the best results. Percutaneous discectomy is offered for the less predictable scenarios, thus with less predictable results. Then there's the issue of knowing whether the offending disc material has been adequately removed, as visualization is not always optimal. People forget that the perceived lower risk of the percutaneous option is not taking into account the risk of continued pain after surgery. A 2018 study examined patients who had a former percutaneous discectomy. There were complications including incomplete removal of the disc herniation, nerve root injury, dural tear, and recurrence of the disc herniation. These minimally invasive procedures are appealing to many because of the small incision and quick recovery. It does not mean there are no risks. As in all surgery, proper patient selection and experienced surgical skills favor satisfactory outcomes. This is also reiterated in a recent 2020 study that states the steep learning curve for surgeons and the lack of relevant experience contribute to the lack of predictability when it comes to percutaneous discectomies. As with all surgical procedures, there are risks and potential complications. Please have your surgeon discuss the expected outcomes as well as further treatment options if the surgery does not result in improvement of your pain. And most importantly, before you pursue any surgery, make sure you have exhausted all the non-surgical options. This part sounds scary, but it's a truth that few want to hear. There can never be a guarantee. While surgery can be a great option for those with well-defined herniated discs and matching physical exam findings, know that the goal should be reduction of pain and return back to normal activity, not specifically about the technique or how to achieve that goal. I know when the pain gets to be a frustration, the appeal of surgery sounds great. But please remember there are risks, benefits, and alternatives to all treatments. Make sure you understand them before signing up for any surgical option. Until next time, this is Dr. Shipp.